You realize that the internal inner sphincter dysfunction is a leading cause of fecal incontinence, especially in elderly women. So women, you have an elderly woman who presents with fecal incontinence, the most likely cause, again, let me say this, the most likely cause is internal anal sphincter dysfunction. Internal anal sphincter dysfunction, as age-related degeneration and prior obstetric injuries weaken the internal anal sphincter. So what are the two factors which weaken the internal anal sphincter? Number one, previous obstetric history. The patients might have had multiple vaginal deliveries. Number two, just by virtue of the fact that the patient is growing, they have age-related degeneration of the internal anal sphincter. So if you see an elderly woman, think about those two things: internal anal sphincter problem, and it could be because of prior obstetric history or age-related degeneration of the internal anal sphincter. How do I differentiate between a patient with pudendal nerve neuropathy and a patient with internal anal sphincter atrophy? The patient with pudendal nerve neuropathy, please write this down and take a picture and send it to me on my phone number +1 306 891 5649. Pudendal nerve neuropathy, write that equation down. There is, number one, decreased squeeze pressure, and number two, normal resting tone. So in your board exam, if you see a patient with reduced squeeze pressure and normal resting tone, think about pudendal nerve neuropathy. Now, the common one that people confuse that with, and I saw that in the answer options, is internal anal sphincter atrophy. Internal anal sphincter atrophy, the patient will have reduced resting tone. For internal anal sphincter atrophy, the patient will rather have reduced resting tone, but with pudendal nerve neuropathy, their resting tone is normal. And so these are the two main ones that people confuse, and that is why I'm stressing on it. Please make sure you master that.